81,980 test results have been received since the beginning of the pandemic. That is 15,479 since yesterday. That is a very, very solid number. And when you think about similar numbers in the days prior, our testing performance over the last week and certainly the last fortnight has been nothing short of stunning. And I'm so grateful to everybody who has come forward and got tested. Now, the key point now, getting tested when you've got symptoms and getting tested as soon as you register those symptoms is going to continue to be such an important thing. Even though we've got 0 cases yesterday, today, if we're to stay on top of this, then people need, as soon as they get those symptoms, because with no flu, hardly any cough and cold across the state, if you've got symptoms, there's every chance that you've got this virus. Come forward, get tested that day. Don't wait till tomorrow, don't wait 2 or 3 days. All that time you wait, you're potentially spreading the virus to others. We're very grateful for so many people who have come forward and got tested. It gives us great confidence that these numbers are a true reflection, an accurate picture of how much virus is out there. But particularly as we open up, coming forward and getting tested as soon as you register even the mildest symptoms is critically important. We'll support you and we'll support you to make sure that we keep your family and every family safe. There are 7 healthcare workers who are active cases. The rolling average to 26 October is Metro 2.8 and Regional Victoria just 0.2. Unknown source acquisition or mystery cases for the 14-day period to 24 October is 6, and they are all in metropolitan Melbourne. The Metro regional splits 85 and 2 in regional Victoria, and those two are those 2 from the Greater Shepparton area that we've been talking about for quite some time. There are just 4 active cases linked to residential aged care settings, a very important reduction given the risks in that industry. Now, they are the numbers of the day, and they are numbers that every Victorian can be very proud of, because every Victorian has built those numbers through sacrifice, through hard work, through hurt and pain, but through an absolute determination to defeat this second wave. That made yesterday's announcements possible, and further easing beyond what we've already foreshadowed for midnight tonight, the 8th of November, and indeed beyond that, these next steps that we will continue to take as we work towards that COVID normal will all be dependent upon people following the rules, people making the right decisions at a very personal level. What all of us as Victorians have built is a precious thing, but it is fragile. We will be able to find a COVID normal, but we will all have to play our part in that. And arguably, there's nothing more important than going and getting tested when you've got even the mildest of symptoms. You can't go to work, you can't do anything other than go and get tested. We will get your results back as fast as possible, and if you are positive, you will have played your part in stopping the spread of this virus, and that's what each of us have to do. All the simple things, and we've talked about so much stuff in the last few weeks. We may not have made some of the basic points, and I'll just do that again quickly. Any symptoms, get tested, and get tested fast. Hand hygiene, coughing into the crook of your arm, keeping your distance 1.5 metres, wearing your mask and wearing your mask properly. All of those things, in an aggregate sense, when you add all of those up, that's what's delivered these numbers, and that's what will keep them low. Arguably more important than ever, those simple and basic things. Millions of Victorians making hundreds of choices each day. There is room for things to go wrong. We don't want that. We want everyone to be vigilant. We want everyone to understand that this is precious and we can't take it for granted. We also can't assume that there's a vaccine turning up next week or that it's over because we desperately want it to be. It isn't. It's going to be with us for quite some time. Now, yesterday, I did promise that we would do some further work overnight to refine how visits into people's homes would work. Before I just go through that, I want to make again the point, arguably, your home is the most dangerous place for the spread of this virus. And I know that jars with people. It may not sound right. But when you think about it, that's where people let their guard down. That's where people are not being supervised. It's not like a cafe. It's not like going to the pub, where it's a licensed environment. It's a regulated environment. People are keeping their distance. There's cleaning to that industrial standard. There's all of that formality makes that a safer place in some ways than what normally people would regard as the most safe place. their own personal space, their own home. But when you let your guard down, this virus will take advantage of you. And that's why there do have to be rules, but we're very pleased to be able to announce that people will be able to reconnect again from 11:59 p.m. tonight. What we will move to is a situation where 2 adults will be able to visit another home accompanied by dependents that cannot be left unsupervised. Visits must occur, at least for the next couple of weeks, within the 25 kilometre limit, and only one private gathering, only one such visiting event can occur per day. Meaning if you have somebody over to your house at, say, lunchtime, you can't visit another house that night. So, mum and dad and 2 children go and visit grandma and grandpa. They can be there, provided they're within the 25 k's, they can be there for as long as they choose to be there. But once they leave, neither they can go and visit anybody else, nor can grandma and grandpa have other visitors to their home that day. This is just about making sure that people can connect, but we can't have a situation where people are having visitors in the morning, visitors at lunchtime, visitors in the evening, and then each of those visitors are in turn going and visiting other homes also. I know people may want to do that, but that is not, on the best of public health advice, safe at this point. It will be at some point in the future, but if we want to lock in these gains, then we have to keep some sense of formality, some sense of we have to mitigate the risk, and we have to acknowledge that risk. So it's one visiting event in your home, 2 adults and dependents who can't be left on their own. And that means that's your one visit, and the person who you're visiting, they can't have other visitors after that as well. We'll put a form of words up on the website today. It is relatively simple. There will be some complexities with single parent households and some other arrangements. We'll try and provide absolute clarity. We won't do that on the run. There are some words, I won't read them out now, but we'll try and work through all of those so that there's clear advice for everybody. But I know it's not a nice thing to say, and it's not a nice thing for anyone to have to acknowledge, but the place where you feel safest, your home, is actually the most dangerous environment for the spread of this virus. That's why there has to be rules, and if we all follow those rules, then we will keep each other safe. We'll be able to see the people we've missed the most, see the people we love the most, but do it in a COVID-safe way. We would also ask that people keep a record of who's been to their home and when. We don't think that's too much to ask. If there is an issue days later, it's always preferable to be able to simply search and have an accurate picture of who came and visited you. It's a small thing. It's a small thing, but it can play a big part. These rules will not be in place forever. They'll be in place for some time though, and then we will revise them, and if we can do more at that stage, if we can have more people visiting, things of that nature, then of course we will. But at this stage, one visit to your home, 2 adults and their dependents, just the once per day. And that means if you're having visitors, you can't be a visitor to somebody else's home. And if they have visited you, they can only visit you on that one day. It's not a bubble arrangement. You could have different visitors each day, but just the one set of visitors. That's the most important point. All of this will be on the website. There'll be a proper comms campaign to make sure everybody understands these rules. I think they are quite simple, but we'll make sure that there's no doubt anywhere and that people can connect with those that they have missed the most. Now, 25k stays in place at least until the 8th. Metro Regional Ring of Steel stays in place until at least the 8th. We do hope to be able to lift those on the 8th, and that will mean people can travel across Melbourne more broadly and travel into regional Victoria and vice versa. But that is not safe for us to do right now, but it will be in just a couple of weeks' time. Now, following substantial interest in a whole range of other matters, I can confirm for you that there will be a detailed advisory on Halloween, masks in gyms, home businesses and workers within the home that will go up on the website, the Savo, so that everybody can have absolute clarity about each of those matters. And if there are other issues that people want to raise, then we'll be more than happy to take those on notice and provide the same thing. So that this afternoon there will be detailed advice That'll be written in the plainest and simplest terms so that everybody's got clarity about what they can and can't do as we move into this, what should be a period of pride and optimism that we have defeated this second wave, but it's not over. The virus is not gone. It is still there, and if we don't prove as stubborn as it, then it will be back. We just all have to keep playing our part, and that's why I'm so proud and deeply grateful to every Victorian who has. That's what's got us here. Now we just have to jealously guard this precious thing that we've built and make sure that, yes, we open up, but we do so in a COVID-safe way. The Minister and the Chief Health Officer are both here, and all three of us are happy to take any questions you have.
Premier, will you look to review that indoor rule around the November 8 mark?
No, that will remain beyond November 8, but we will review it over time. And what I said yesterday, just so there's clarity for everybody, we'll have more to say on the 8th of November about the balance of November and indeed what COVID normal Christmas will look like. And then some point after then, we'll have more to say about what the rest of summer looks like, and hopefully by that stage, so toward the end of the year, we can paint a picture. It'll never be certain because it's an unpredictable thing, but we'll give people as much clarity as we can about what 2021 looks like as well.
So just going beyond that and drilling into what you were saying about Christmas, can Victorians look to plan their Christmas any time in November? If you're not reviewing around November 8, obviously Victorians want to have friends, family at their homes.
Of course they do.
Can there be clarity on that?
As soon as we possibly can. We'll give people as much notice as we can. It won't be Christmas Eve that we tell you what the arrangements for Christmas Day are. That last step, when we propose to take that last step and move into COVID normal, what I'm saying to you is I'll be able to confirm for you what our aims are on the 8th. I can't quite do that yet, but as soon as we get to the 8th, we'll have the data, they've done all the work, and we'll be able to paint that picture about what the rest of the year looks like. And people, Simon, will have they'll have significant notice about what we hope Christmas to look like. But again, that will be in the hands of every single Victorian. If we continue to be, vigilant, if we continue to follow the rules, as frustrating as they are, then we will be able to have not a normal Christmas. We can't deliver that, but we can have a COVID normal Christmas where you can have family around to home, and you can celebrate something that looks much more like a normal Christmas than we perhaps have imagined at any point this year. But the day for us to paint that more complete picture of the rest of 2020 is indeed the 8th.
You've emphasised dependent children who can't be left on their own, who can't be left alone.
Yes.
Does that mean you would expect, say, teenage kids to be included in the 2 people?
No, formally. So I'll give you the example from our family. So it'd be Kath and I come visit you, James. We've got 18-year-old, 16-year-old, 13-year-old. Perhaps the 13-year-old needs to come with us, so he would come with us and we'd come visit you, and that will be the only visitors you receive that day, and your place would be the only place where we went that day. The 18-year-old is not in fact a dependent. He is treated as an adult, but the reason it's not just kids, somebody may have an elderly relative who's part of their household and it's not appropriate to leave them home. So we've tried to make it as flexible as possible, but the challenge with this is you want it to be clear. The main point here, 2 adults and those who can't be left alone, and an 18-year-old is counted as an adult, not as a child. Then the really key point, 1 group to visit you, and they can't visit anyone else that day, and you can't receive any other visitors that day. I know it gets a bit torturous, but that's as simple as we can make it.
It's 1 visit per day, whether you're visiting or being visited. That's
correct.
It.
Exactly.
And what's the situation for those teenagers if they want to visit people? Are they able to visit?
Well, that would be that will count as the 1 visit to that house. So if one of my kids wants to go and visit a friend, then that's the only visit that person can make, and it's the only visit the only visitor that household can have. So it's just about trying to limit the amount of contact as much as possible. And it's not easy to write these rules. We've never had to do this. We've never had to do this before. There will be, again, some arrangements for single parents and things of that nature, because we understand that trying to define a family is quite challenging. Trying to define a household sometimes is really hard too. We'll have all of that up on the website this afternoon, so that people have got as much clarity as we can give them.
A 4-person share house, for example.
Yeah, so
they'll be able to have,
that is exactly
they've
right.
got to alternate over 4 days, maybe.
Exactly. So share houses are a particularly challenging environment, and we do have a set of words around that. Now, I do stress though, whilst the share house, the notion of having a rotation, that's what will have to happen inside the house. You can go down the park though with as many households as you like, as long as you haven't got more than 10 people. So again, we'd always encourage people to try and connect outside, to try and utilise those rules that we've written. But this does give people an opportunity to connect inside in their family home. I'm sorry that there have to be limits, but there's just no other choice that we can responsibly and safely make. Now, on masks, we would recommend that people wear masks whenever they can. We can't enforce that though. I'm just being frank about it. We're not going to have police knocking on every door every day, but we just ask people to use some common sense, because that's what's got us here. People doing the right thing and being practical, being determined. That's what's delivered these numbers. And if we can just keep doing that in all the little choices we make every single day, that adds up to a big cumulative effort that makes us as a community a much smaller target for this thing, a much smaller target.
Just to clarify Rachel's point on teenagers. So if your 16-year-old teenager visited a friend, can you then visit James?
Yeah, we're going to have to work that through. Certainly for the purposes of, and Brett might want to add to my answer, for the purposes of the person who's received my 16-year-old daughter as a visitor that day, well, that's their one visit. In terms of the rest of the household, Brett may want to add to that.
I think it's one household visit, so that would be it for your household.
Yes, that would be it for the household as well. Sorry, it's always important to get the wording right. And there are 1,000 different options here, but ultimately, if you think about it, Grace goes and visits a friend. Grace comes home. We might as well all have gone and visited, because Grace could be bringing the virus back into our house. So that's the basic logic to it. I paused just because we don't want to do anything other than be accurate. But one visit to your home, and then that means you can't go and visit anyone else.
And just on the November 8 timeline, is there a possibility or an opportunity to bring that forward if case numbers continue to?
No. And the reason for that is, as we've said many times, it just holds fast that time, as frustrating as it is, the longer we wait between steps, the clearer the picture we have, and the more confidence we have that the picture we're seeing is in fact real. The life cycle of this virus is in that sort of 10 to 14 day period. If we could go earlier, of course we would. And if we could have jumped straight to the 40 inside and 70 outside from midnight tonight, we would have done that as well. But I think that what I would commend to all people who live in Melbourne is have a look at what's happened in regional Victoria. We have done this the steady and staggered and safe way, and now we've got the settings that will apply in Melbourne on the 8th. They're applying in regional Victoria now, and some of them have been working for a couple of weeks, and they've worked very well. Even when we had the Shepparton issue, we're able to pull that up really fast.
Sorry to labour the point. Just to be absolutely clear,
you've got another one of these permutations for me, I'm sure.
No, just to make sure, the two people and their dependents must all be from the one household.
Well, you've got two people plus their dependents visiting another home, and they cannot be from multiple homes.
Right.
Otherwise, you've got 3-4 homes visiting each other.
Yep.
And then that means they all radiate back to their own homes. So it's one household, 2 adults and dependents, to your household once a day, and you can receive no other visitors. Simple as that.
So you can't have 2 adults from 2 households come over?
No.
No, and yeah, and
How do you police
No.
Premier?
Well, this is the challenge. We can try and write rules that are as simple as possible. That's what we've tried to do. Now, there'll always be 1,000 different, because everyone's complex, right? The key point here is we only want 2 households connecting. And we did give some thought to the notion of, Simon just made the point, I think, about 2 different adults coming from 2 different households, but that's 3 households meeting together. That's not 2. So that's not that.
I think I was referring to that more like 2 single adults, for example, coming over.
Well, no, hang on. Single bubbles remain in place. They've worked well. We're not changing those, right? But we'll have some more advice for what these rules mean for those people, and we'll put that up on the website. There should be no change. Ultimately, what we've tried to do here is just have one household and a second household connecting once a day, and then they don't connect inside with anybody else. They can go off to the park and meet with another family, but of course that means masks are worn. It means that we're out in the open air, and that's a much safer way of doing things. In terms of how do you enforce this, well, it is simply, all I can do is I can appeal to every single Victorian, and particularly people in Melbourne for whom these rules apply now, to stay the course on this. These rules are not written for any other reason than to keep the numbers low, to keep the risk low, and to make sure that we can continue as each week, each month passes, we can have more opening up, more easing, more changes to the rules. So we keep stepping forward. We're not having setbacks that mean we have to potentially change some of these things. That they are rules that they're written as simply as possible. We're not going to have police knocking on every door. We just can't do that. But I would say this, it won't be a matter of police having to be out on patrol. If someone's got 40 people at their house, then my bet from experience will be that someone across the road or next door will ring up the police advice line, and whether people have had some negative commentary about that's not the wrong thing to do. That's what people should do, and then police will attend and people will be dealt with, because that's not safe. But the thing is this: it's not just unsafe for that household who's having a party with 50 people. It's unsafe for everyone, because the thing spreads so quickly and so silently. So we are not in a position to be able to regulate and police what goes on in every single home right across Melbourne or right across the state. But I would just remind, I don't think people need reminding, but I'll just remind people, we all know what's at stake, and if the rules aren't followed, then the risk of new cases is much, much higher.
And are there new rules? Oh, sorry.
So go Alex and then Samaya.
Just on the work issue, we've had quite a few people getting in touch with the paper this morning, kind of saying that cafes are back, work is back, and people are actually preparing to return to the workplace. So can you
Offices, you mean, Alex?
Offices, yeah. So can we just clarify, obviously that's not allowed, but can we clarify all the details of
Sure.
what is a permitted workplace? And
So we move beyond worker permits, and we'll go back to that setting we had some time ago, where if you can work from home, you must work from home. Now, I know that's frustrating. I know that there are many businesses, large and small, who want to get their staff back on site, but those environments at this stage are too risky. We'll have more to say, again, part of that picture about what the rest of November looks like, December, and then hopefully a pretty good picture of what the early part, at least, of what 2021 looks like. On the 8th, we'll be able to update people on that.
in terms of workplaces that choose not to obey those rules, they will. You still have those workplace task forces going out and doing checks, and they will be fined.
They will, and I hope that we don't have to do that. Again, the most important thing, it's got to be staged, it's got to be safe, it's got to be steady, and if we want 2021 to look vastly different to 2020, then we have to finish this year off. We have to finish it off properly. And as I've said many, many times, we can't sprint to COVID normal. We just have to do this in a steady way. And I know some people will see that as slow, and some people will have views on that. That's fine. There's nothing wrong with that. But the key point here is we've got to do this properly, and that's what I'm absolutely determined to do, and that's what the public health advice tells me.
And how long do you think it's have clarification?
Sorry, Samaya's next, and then Laurel.
I was
Samaya.
hoping to get some clarification around play dates with like young kids. Can multiple kids from multiple households visit one family or like one other household?
You can only have one other household to your home. If that was outside though, if it's at the park, provided it's not more than 10 people and children under 1 year, so infants under 1 are not counted towards the 10. Children are counted towards the 10. So you could conceivably have, say, 2 or 3 parents and 5, 6, 7 kids. There's no household limit. It could be 4 or 5 households because it's outside. Can't be more than 10. So a play date can happen, but it would only be your household and another household if it's at your house once per day, and then neither of you can go and visit anybody else. That's your one event per day. Tick, done. Outside, though, it can be 10, and there's no household limit.
So a parent, you have a 3-year-old, you have a 4-year-old, and you want to accept a 3-year-old from another house and then a 5-year-old from another house. You can't do that.
If it's outside, you could. If you
But
do it in your
indoors, you
home,
can't.
you'll only be able to do it one
Yeah.
household to your house per day.
That's fine.
And we'll put all this up so that there's some absolute clarity around it. But that is the answer to the question. Someone might wordsmith it better than I just did then.
Just on masks, Premier, how long do you envisage that we'll be wearing masks for? I guess particularly in regional Victoria, which has very low
Yes.
cases.
Well, this is one of those trade-offs. If we're going to have that ring of steel gone on the 8th, and we're going to have people from Melbourne travelling into regional Victoria and vice versa, and that's important for tourism, for compassionate reasons, for lots of different reasons. Masks need to be with us across the whole state for some time to come. I know it's frustrating. I know that no one particularly enjoys wearing a mask. There are some exemptions that I think are appropriately cast, but at the same time, it is a very low price to pay for potentially a very significant benefit. The sort of cost-benefit ratio is very much in our favour, and many other countries around the world have shown that the maintenance of low numbers and mask wearing kind of go hand in hand. Will it be forever? No. It'll be for as long as it serves a useful purpose.
So what's your best guess? Is it till the end of
We'll
the
be
year?
wearing masks. We'll be wearing masks, I think, at least till the end of the year, and we could be wearing masks into next year. Now, the public health team, they'll provide us with advice, but I've tried to be pretty clear with people. I'm a holdout on this because I do think that it does serve a very useful purpose. No one should read into that I'm enjoying it or that anyone's enjoying it, but it is important. And I think if you weigh it up, you wear the mask, but we can be open and then take another step and another step beyond that. That's worth doing, I think. It's absolutely worth doing. But it is important not just to wear the mask. You've got to wear it properly, and you have to be vigilant. You've got to take it seriously. You've got to take it seriously, because you can have this thing and not have any symptoms hardly at all. You would have no sense that you had it. And if it weren't for the mask, what we know for certain is that more people would have been infected in the last, however long it is, I can't recall exactly when we moved to mandatory masks across the board, but we absolutely can be certain there'd be more people would have been infected with this virus if we hadn't had masks, and more people would be infected if we got rid of them now. We will be able to move away from it and maybe have some more flexible settings where you don't have to wear it quite as often maybe. But that isn't for today. That'll be some weeks off.
And
We have
when you refer to
fortnight
people letting their guards
cases.
down in each other's homes, when you refer to homes
Yes.
being dangerous because people let their guards down, that
Yes.
includes mask wearing as well. It feels unnatural to...
Yeah, it does. It does. And we would recommend that people keep the mask on. But I fully acknowledge that we can't police millions of, certainly hundreds of thousands of households. But it's a choice for hundreds of thousands and millions of households. If you make the good choice, the smart choice, then you can be certain that you're playing your part in not only having got the numbers low, but you're playing your part to keep the numbers low, so that you can have visitors. We can be back at work. We can be open and opening further as the weeks and the months unfold. It doesn't feel natural at all, and it will be frustrating to some people that they can only have one other family, in essence, to come and visit them once per day. But the notion that we just have dozens and dozens of people from multiple households getting together in an environment where we just know, and if we all think about it for just a moment, we all know deep down that some of the formality at a hospitality venue is not the way we live our lives in our own home. And I know it's very challenging to flip a certainty. All of us see our house as the place where we are safest. When it comes to this virus, that is not the case. Your home is arguably the most dangerous setting for the spread of this virus, and that's why these rules are in place. We've tried to make them as simple as possible. Some of this isn't simple, but we'd be indebted to you to help us push that message out.
Will
Will
mask
exceptions be
issue-
made for people that don't have family or friends within 25 kilometres?
Not in terms of the next couple of weeks, but after the 25 Ks is lifted, then there'll obviously be greater freedom to move, and there'll also be the opportunity, we do hope, to be able to move into regional Victoria as well.
And intimate partners that don't live together, do they count as a single household if they go to go
The
visit
intimate
someone
partner
else?
arrangements are unchanged.
Just in terms of the masks
In
and
the hospitality industry.
Sure.
Does the old rule still apply where they have to have a maximum of 2 hours per booking?
No, we've not gone to those time arrangements. We've left that up to individual venues, which I think is appropriate. I would fully anticipate, though, that that's exactly what venues will do, because they'll want to have multiple, because they're constrained in numbers, they want to have multiple sittings, I suppose is the term. The other thing too, some of the time limits were appropriate because, I think it's not a great test of we don't have to be particularly creative to work out what happens if people are potentially at a venue for 4 or 5 hours. Let's just say that their compliance might be expected to be a little lower by the end of the 4 or 5 hour lunch than it might be at the beginning. And that's not a bad thing, but it can't happen because it puts everything at risk. I think our bars and restaurants and cafes, pubs have done an extraordinary job. I'm very confident that they'll have safe practices in place. They know and understand what's at stake, and we want to get them to 40 inside, 70 outside, and then keep taking further steps beyond that. And the only way to do that is for everybody to take it very seriously, and I believe people in those industries do.
Premier, there's some concern from gym owners about capacity in terms of how many people can exercise in the gym. In New South Wales, I believe it's 1 person per 4 square metres, but in Victoria it's going to be 1 person per 8 square metres. Why is that rule in place, and do you expect it will change as time progresses?
I think they are a little further along than us. I'm not sure where they started in relation to the reopening of gyms. I know that I just saw the other day that the Health Minister in New South Wales was making further announcements about 24-hour gyms, things of that nature, so that was only just last week. So I think they're making changes, a bit like regional Victoria's ahead of Melbourne. There may be parts of New South Wales that are ahead of us, just because of the way the virus is presented. We'll be reviewing all of these over the course of the next few weeks, and if we can make any changes, we will. And we do know that industry's been hit very hard, and if there's further support that we can provide to them in whatever form that might take, then we'll definitely look at that.
Do you accept it might not be viable, though, for a business like a gym to operate when there's only 1 person per 8 square metres?
I accept that it is a very, very challenging setting, and it is a high-risk setting. People are exerting themselves. People are, this is an airborne thing, plus it's on surfaces. There's only so much you can do to make it safe. And the advice is to go beyond those settings right now. That is, to do more than that right now is not safe. That advice can change because the broader conditions will change as well. But at this stage, they are the settings, and we'll look to provide further support to that industry if we have to, because we do know that they're in a kind of unique place given the risk profile.
Premier, just a couple of questions on travel.
Yes.
Have you had any further discussions with Ms. Claire Gickley up in New South Wales about the border, and particularly for regional residents?
Sure.
Firstly?
No, I haven't had an opportunity to do that, but I expect I'll have some conversations with other premiers later on this week, and that would relate, I think, principally to New South Wales and SA, but I'll probably have a conversation with Peter from Tasmania as well. Beyond that, I don't think WA settings are not going to change. And I don't think Queensland settings are going to change either. They've got a timetable that they've laid out, but I don't know that that'll necessarily relate to us in the first instance. Northern Territory, I think, is already there, so I think that accounts for everybody.
Is it a case where you have to offer to Gladys, what's safe, I guess, for them, like in terms of regional residents first being able to go over the border?
No, I think it'll just be a discussion about where they're at. Do they have all the data they need? Are they comfortable that we're giving them everything possible so that they've got a real sense of what's going on? And then I think as soon as we can get it open and we can be agreed on that, we will. And I think it's logical that it'll be regional Victorians into New South Wales and SA first before Metro Melbourne, just given the different positions that country Victoria, regional Victoria and metropolitan Melbourne are in. Those will come into alignment at some point, just as on the 8th of November we're pretty clear that we want to get rid of the 25Ks and we want to get rid of that ring of steel as well. So if all of Victoria can be united then, I don't see why we wouldn't be able to be united with New South Wales to the extent that people felt the need to go there. I'd be encouraging people to stay very much in Victoria and spend whatever they can on a holiday in regional Victoria rather than heading to New South Wales or anywhere else for that matter.
Just on international travel.
As much as some of us might like to go and play golf in Tasmania, for instance, we won't be doing that this year.
Well, you'd hope to, I imagine. Premier, just international travel. Have you
Yes.
had any requests from Jennifer Coate or changes to the timeline of the report?
No.
So international. Is the quarantine system though started to get ready though for it?
We are doing what needs to be done to be ready, assuming the report is received on time. I don't have any reason to believe that it won't be, but it's Tuesday today. I don't know what requests might come forward tomorrow or the day after. I've given you a commitment that if I get a request around that, I'll be clear with you. The key point is I think it's appropriate to wait and see what if any recommendations they make. They may, I'm certain, well, almost certain, they'll have some views on how the system should be stood up again. I think that's the most appropriate thing to do, and then that way we can build the system again, have international flights return, and have confidence in the arrangements that are put in place.
Just back on state borders, sorry.
Sure.
Glasgow Victorian had said today that before opening the state borders, she wants to see the effects of the easing of restrictions. Is that something she's communicated with you?
No, but I don't think it's not a startling comment in any way. I think we're all going to look very closely at how things go in the next few weeks.
Just in terms of the mandatory mask wearing, the justification of the mask wearing has always been that we had much higher case numbers than other states. Can we just go through with what the health advice now is, and has it been reviewed in consideration that other states were quite quick to remove the mask wearing guideline?
The advice remains that masks are playing an important part.
Is that based on the mystery cases, or what is?
It's based on where we've come from and where we are now, and the fact that there's always more virus out there than you know, because not everybody gets tested, and not everybody who does get tested gets tested quite as fast as they should. Plus, there are still some mystery cases. We're all pretty happy to be able to report just 6 mystery cases in the 14 days to 24 October. That's a massive improvement on where we had come from. But there is still some virus out there, we know that. But masks are an important part of this now. They won't be there forever. They are uncomfortable. It's not a permanent setting, but it'll be there for so long as the health team are really clear with us that this does play a role. It has a part to play, and if that gives them greater confidence to advise me to keep on opening up, then I think that is exactly the position that we want to find ourselves in.
Just on holidaying in regional Victoria,
Yes.
Will there be caps on the number of households and the number of people who can book like an Airbnb accommodation, for example?
If you look to the settings we had previously, and the settings that as I understand it, operate for travel within or overnight within regional Victoria, that's certainly what we had last time. That it was just the one family. Might have been 2. I'll have to go back and have a look. But well ahead of the 8th, we'll have settled that matter internally, and then we'll try and communicate that as quickly as we can, so people can take bookings that are compliant with the rules.
Can you also carpool somewhere with a friend and consider that as part of that household to household visit?
I don't think we have rules as such around carpooling, but we would discourage people.
It's discouraged.
Yeah, it is, and I don't know that we necessarily need to formalise that beyond that. We've certainly discouraged it in relation to work, because it's no good having quite extraordinary lengths that employers have put in place to have different cohorts, not having crossovers with shifts, people doing the lunch and breaks in shifts, if you like, all of that stuff, and only to then have large groups of people from multiple households coming together for an extended car ride. But again, some of that is another example where masks play a role. Masks would very significantly reduce the risk if that in fact happened.
Next week, has said that people inside your office have been trolling her online. Is this something that you're aware of?
It's complete nonsense.
You emphasised in your opening remarks that
Yes.
as we open up, you want people to still keep getting tested.
Yes.
I understand this is something that's happened interstate, where as it starts to feel as if we're getting more back to normal, the testing goes down. Is that what you're worried about?
I have a concern that we have to remain vigilant, and I know that there's a real buzz and an energy around the city and indeed the state today, because people can see what they've been able to achieve. They see what they've built, and they know and understand that it's come at a really significant cost. But we all have to remain vigilant. And I know that's not what people want to hear. They want to hear that it's over. It isn't over. There's no vaccine, which means getting tested, following the rules, playing your part, making good choices for your family and every family. I'm not asking for any other reason than it's essential to us staying open and continuing to open up further. Continue to take those steps forward rather than having setbacks. There will be cases. Not every day will be zero. There will be cases, there will be outbreaks. We're well placed to manage those. But the management of those is a partnership. Not just the public health team, as big, as hard-working, as committed, as professional as they are, but every family, every single family. And if you look at the northern suburbs, we had a massive team working on that. And then we had almost an equal number of local community members, faith leaders, multicultural leaders, school leaders, doing an amazing job. We all have a part to play and we all have to play that part. Testing is very, very important, and that's one of the reasons a couple of weeks ago we moved to, whether you technically call it sentinel testing, I'm not quite sure, but we're going in and testing 25% of the workforce each week, so half the workforce in a given industry over a 2-week period, some of those high-risk workforces. We may move to some of that sentinel testing just to get a complete picture and get a robust sample if testing was to drop off. It'll be always reflective of how many symptoms are out there. And I think, if you could test every single Victorian every day, you would, but that's not feasible, that's not possible. But the most important thing that people can do right now, and what we know right now, is if you've got symptoms, even the mildest of symptoms, please come forward and get tested today. Don't wait till tomorrow or the day after. Please get tested today. You want to ask Brett some things?
Can I just ask you a question on testing?
Sure. Yep.
Rapid testing, is
Yes.
that going to be rolled out soon, or is there being a power of work being done?
There is a lot of work being done on rapid testing. It is not quite as accurate as the longer form testing, if you like, but the turnarounds are really, really quick, and it can help just in getting, not a complete picture, but getting more of a picture than no testing in given settings. And I think it has been a feature of outbreak management in recent times, and it will continue to be. There's a number of different technologies and different platforms that are proving successful there, and we are doing a heap of work to be ready to have enough of those kits. And again, we're kind of captive to the science. These things get validated. They may not be quite as accurate, but they are an important tool.
And do you have any idea when we might see a wider spread use of rapid testing, or when that work might be a bit
More than happy to come back to you. There's a team working on that. Jerome and his people, Ewan, Brett, Alan, a whole lot of people are working on that. We might be able to come back and give you an answer on
I've got a couple of questions about retail, particularly in shopping centres.
Yes.
There seems to be some lack of clarity about how many people are allowed into shopping centres as opposed to shops themselves.
Well, there's rules in there in the document yesterday in relation to food courts and things of that nature. More than happy to come back and give you some clarity on that. Well, I think we've gone to that in some detail, but if there's any need to clarify or add to that, we will. The other point around shopping centres, not so much the really big shopping centres, but strip shopping centres and smaller suburban shopping centres. People have raised a few concerns about just making sure that there is a little bit of formality so that people know and kind of being monitored that they are wearing their mask properly, that people are keeping their distance. So I think Victoria Police and authorised officers will make, for no other purpose than keeping people safe. We just have to make sure that in every setting people have got that kind of discipline to make sure that they're doing the right thing. We're happy to clarify anything we need to clarify around shopping centres.
Do you have any further clarity regarding cinemas and theatres when they can reopen?
No, we've had some conversations about outdoor entertainment, and there's some formulas in there about fixed seating and 25%, 50 being the cap. We'll have more to say about some of those indoor settings on the 8th.
In terms of households being able to gather outside, you said up to 10 households outside.
Up to 10 people.
Yeah, 10
yes.
people.
No, there's no limit on the number of households.
Yep.
There was previously just the 2.
This seems like a very specific question, but
That's all right.
Can you play a game of outdoor soccer with 10 people?
Let me come back to you. There are some. Well, no, sorry. Well, you can't until we confirm. Can I answer like that?
Yeah.
Well, you could do 5 aside, but there's issues about.
There's a ref.
Yeah, there's issues about. There are rules around about more organised sport. But again, I don't think we're getting to the point where if people want to kick the footy in the park, provided they're not in a group more than 10, provided they're wearing a mask, then that's a perfectly healthy thing to do. The broader issue here is the number of people that gather together, not so much the activity that you are engaged in. But if it's no more than 10 people, you're wearing your mask, you're being COVID safe in all the other ways, you're within the 25k, so on and so forth, then that's what we're really focused on. But I will ask that, as you said, it's a specific question. I will make sure that we have a detailed answer for that.
Melbourne Cup Carnival next week. Will owners be allowed on track now?
We're finalising that at the moment. We'll have more to say about that tomorrow, I think.
So likely then?
And I wouldn't make a judgment either way.
Okay. And just on bigger events moving forward to next year, I know it's difficult to predict, but a lot of big events obviously need a bit of notice.
Yes, they do.
When do you think you might be able to provide event planners with some notice about what happens?
So we've been working very closely with the Australian Open, been working very closely with the Boxing Day Test. There's a whole range of other events, not just in Melbourne, but in regional Victoria as well. We've been working through all of those, and we'll make announcements at the appropriate time. What we've essentially done with those event organisers is talk about a whole lot of the logistics that they're going to have to go into, particularly when you're talking about international events where there'll be people arriving from overseas, where they do their quarantine, how that quarantine is done, all of those things. That's all being talked about in some detail. And then we've probably talked about a few different options. So we can't give them a definitive answer today on say, a crowd size, but we can talk about what might be possible and a few different bands, if you like. All of those matters will be finalised, but people should rest assured we're working very hard to make sure that we've got as many options as possible for things like the cricket. I think that the partnership with the ICC and the MCG is very strong. The partnership with Craig Tiley at Tennis Australia and the AO is very, very strong. And we want to thank all of them for the work they've been doing with us.
Brett.
Yes.
You want Brett? Brett's
Please.
good, absolutely. Brett, it's all yours.
Brett, you didn't get a run yesterday, which was a pity.
I didn't get to thank Victorians, which I was disappointed not to have an opportunity to do. So I'd like to add my thanks because I think this isn't the finish line, but what a terrific milestone, and it's a credit to everyone in the state.
How great a relief was it to you when those tests came back yesterday?
Very great relief. I think the whole state sighed with relief. There was some tension in the 24 hours beforehand, so it was it was a genuine roller coaster. So to have so much testing be done, especially in an area that we had specific concerns about, and for not just yesterday to be a donut day, but for today as well, double donut day is terrific. But as I say, it's a milestone. It's not the end. We've got hundreds of people who are still in quarantine as primary and secondary close contacts. So, there's another 10 or more days to play out for all of them. And there could well be some positive tests for those people who are in quarantine. But again, the thing about quarantine is that those are individuals who'll be entirely contained. They won't put others at risk. And that's the principle. And we won't be concerned to see one or two cases if those individuals are doing the right thing.
So are you about further days of zero?
Oh, it'll happen. We're on track. I said it the other day. We're absolutely doing the right thing, and the community response has been fantastic. That is exactly what will deliver more days of no cases. We have to expect additional cases. We have to be mindful of the fact that our biggest challenge now is complacency. Our biggest challenge now is the sense that there's nothing out there and we can do absolutely everything and we can see absolutely everyone without there being a risk. That is not the case, and it won't be the case for a while.
And just on the mystery cases, it looked like from the figures like you solved one of yesterday's 7 mystery cases when now it's 6, and I don't think it was one that was meant to drop off.
Yeah.
Do you have any details on that?
I don't know the specific case that dropped off, but we have an expert panel review every single day. We look through that list of mystery cases in the previous 7 days. Sometimes it's resolved because the genomics and new epidemiological information ties it to a known case. Sometimes the laboratory information tells us that it's probably not a real case. So something like that will be in play, but it's dropped off. There'll be another 3 that drop off just by virtue of falling out of the 14-day window tomorrow. So we're going to have 3 mystery cases, given that there's none today. for the 14-day period starting tomorrow.
We've got one more healthcare worker case, active healthcare worker case today than we did yesterday. Obviously, that's not something from the last 2 days.
No, it's not a new
What
case.
happened there?
Look, it's just the linkage that you make by virtue of knowing that that's an active case at the moment who's identified as a healthcare worker.
Brett, are you confident that Northern Metropolitan outbreak is a full stop on that, or at least it's contained fully?
Yeah, absolutely. The response that Jerome talked about in terms of wrapping everything around those primary contacts and the secondary contacts is really robust. Great stabilisation in numbers, and again, it's not to say that there won't be cases that occur in some of those households, but they're doing the right thing and they're being checked on every day, so I'm very confident.
And can you talk us through the public health advice that you gave to the government about the in-home visits, and just talk to us about the risks, I guess, that have informed that decision, and what your message to Victorians is about that?
Look, it's really about those incremental small steps, and 2 people and from a single household is a recognition that that's really a small and manageable step, but a really important one for people. So many individuals have been wanting to see loved ones and close family. It's not an allowance for everyone across the state, across Metro Melbourne, because of that 25k rule, but it does allow for some in-home visits at that small level, and obviously the issue of dependence and being able to take those individuals with you is just a practical consideration.
Over the past few months, the health department, there's been a constant focus on improving systems, contact tracing, making sure it's as robust. What are some of the things that you're looking to improve over the next few weeks, or what's at the top of your mind that needs, tweaking or improving?
Look, I think the CRM rollout continues. There's lots of elements to that, including the reporting and analytic measures, but it's already got end-to-end processing. It's already got electronic laboratory reporting coming into that system, so it's doing the full job already. But there are some small enhancements that will keep being built in over time. I've been pretty frank about weaknesses or critiques in elements of our response right through, but I will say now, I think our case, contact and outbreak management is the best in Australia at the moment. Again, that's just a frank, might be biased, but it's an honest appraisal of the fact that we've had to step up with really significant requirements. So I think this setup we've got now could do things at scale if required, but even more importantly, at the very low numbers, it is best in country to be able to respond, not just in a timely way, but to do all of the things that are required to be able to go from time of testing to time of completion of first interview in around 24 hours is extraordinary. To go from time of testing, so this isn't time of notification, time of testing to time of contact of all close contacts in around 36 hours is also fantastic. It's exactly what has been spoken of by epidemiologists as reducing the risk of onward transmission by 80+%.
So do you think we're now in a position where we will never need to go into lockdown again?
I hope so. We can't control everything, and it absolutely depends on those individual behaviours, because things can still run away from you with all the best systems for response in the world. If no one turns up for testing, if no one isolates for days after becoming symptomatic, you can't chase that with contact tracing. If people are out and exposing dozens and dozens of others when they're infectious, then you can never get ahead of that kind of a wildfire.
Department Associate Secretary Caroline Edwins, she told Senate estimates today that the COVID Safe app wasn't being used in Victoria at the height of the pandemic. Can you go into a bit more detail around that?
I think there was a couple of week period where we had to work through, as was a legal requirement, the privacy issues of separately cached data. Once that was worked through, it was absolutely being used.
Oh, sorry, you weren't using it. Okay, so you weren't using it because of the caching issues as opposed to because you were too overwhelmed?
No, that was my understanding. That was an issue of working through the privacy considerations that we had to meet in order to meet the requirements of federal law in that respect.
Is it being used now at all?
It is. Clearly people have it. We're still asking about it, and we would still do those downloads if it pings anyone who who's a close contact.
Are there problems with it? I think the Premier suggested the other day that, it had said someone was on a different floor of the hospital to what they actually were. Are you confident that it's actually up to the job?
Oh, it's made Bluetooth connections for people across a wall. That's not a close contact for contact tracing purposes, but that Bluetooth connection can still happen within 1.5 metres. That isn't a problem so much. It'll identify someone who you end up realising wasn't a close contact. But it hasn't delivered as much as we would have liked. As we've said all along, the settings that we've been in haven't allowed for a lot of close contacts. I'd still encourage people to have it on their phone because as we go to pubs and clubs well, not clubs, but restaurants opening and a lot of strangers being potentially within 1.5 metres, then you'd hope it comes into its own at that point.
Premier, you had an interesting expression on your face when I asked Brett about the COVID app. Do you have a view on it? Is it up to the
Everyone should
job?
download it.
Can I just ask you a question?
That is my
I've just got one more for
Oh,
Brett.
sorry.
Sorry, I know you've got to get to Parliament, Premier, but Brett, there's a new opinion poll that gives you a higher approval rating than the Premier. When you went to medical school, is there any expectation that might happen one day?
No.
Do you have any view on that?
Oh, no, not at all. I mean, everyone will have their critiques through all of this. Everyone will have their views on what's gone well and how things have been handled. I think I have been upfront about good decisions and bad decisions and everything in between. There's no question that everyone's done their utmost through this, and there's no questions that lessons have been learned through it all as well. But I'm not here for the applause and don't care much for being vilified, to be honest. I just want the numbers down and I want Victoria to get on and lead a COVID normal life that we're all looking forward to.
How did you celebrate last night?
With a donut. Very fine donut.
As we get to the end of this period, this lockdown, we join a select group of states and cities that have crushed the second wave, but others such as Hong Kong, Vietnam haven't gone to the same extent and duration when it comes to lockdowns. In hindsight, was it as necessary to have duration and intensity of lockdown here? Absolutely. We had no choice. If we, the second waves that have occurred in South Korea, in some other places, have plateaued at dozens of cases. If we had plateaued at dozens of cases and not gotten to the point where we've gotten to today, then there's no opening with South Australia, no opening with New South Wales. The border communities can't have that connection with their neighbouring towns and their neighbouring regions that has been so important for their work and for their life. I think that's a really critical element about why we've driven it to the point that we've driven it to, and with the assurance that we don't need the same levels of control going into Christmas than we would have to have if we had 10 or 20 or 30 cases a day. If that were the case, we'd need levels of control that would limit ongoing the kind of numbers in pubs and in restaurants and in retail and in so many other settings. We can go to a consideration of a much more open way of life that I think is to everyone's advantage.
Sorry, if there was a second wave somewhere else in Australia, say New South Wales, would your advice be to close the border?
Oh, we would make considerations. Again, it's for First Ministers to make that call. On the advice of me, it would be really about the levels that it's at, whether it's increasing or decreasing, where they're occurring, what control measures are in place. So there's no definitive answer on that. We, as Chief Health Officers across the country, we've always made those individual considerations based on the specific circumstances.
Last question, please. Yeah.
You guys know.
I just wanted to ask.
I'm happy to be late to Parliament, but others may not be so happy. So
I'm sure our questions are more fascinating. Just the Jablarung tree, the directions tree that was chopped down yesterday. Yes. Why was it chopped down?
Well,
and there was also some, I guess, miscommunication. One of my colleagues, she was told by Major
Projects
Victoria that the tree hadn't been chopped down when in fact it had been.
Yeah, I'm not certain what's gone on there. I could try and get you some more information, but as I understand it, there's been legal action, there'd been agreements and settlements reached. There's been direct consultation with the 12 families who essentially comprise that traditional owner group, and we have done as we said we would do. This is a dangerous road. It needs to be built. We promised we would. We've been respectful. We've engaged. and we've been true to the spirit of the agreements that had been entered into. But this is a very dangerous road. There are many people who've lost their lives on this road, and I'm determined to get this road upgraded.
Just it's a very, I guess, sacred. This is a very sacred site.
Yes, it is, and that's why we've engaged deeply with traditional owners, and that's why we've come to an agreement that I know not everybody will be supportive of. They weren't supportive of it. They haven't been supportive of it for some time, but at some point you've got to try and come to an agreement and then be faithful to the terms of that. If we waited around to get 100% buy-in on this, if we waited around for an absolute consensus, then that deadly stretch of road would go unimproved, and we would see more people dying on that road, and I'm just not prepared to settle for that.
There are other routes to take on that road, though.
Sorry?
There were potentially other routes to take, you know,
well, we've already made significant. Well, hang on, we already have made significant changes to the design. We've made significant changes to what the upgrade would have looked like. I know people have strong feelings about these matters, but we have had court processes, we've had agreements, we've had settlements. We have fundamentally done as we said we would do, and we have directly consulted and continue to consult with the 12 families that are the traditional owners of this particular part of our state. They speak for that country. I'm not casting aspersions on others who may have views still, but ultimately we've got to get on and get this done. We've done it in as respectful a way as we can, but it is a deadly stretch of road and it needs to be upgraded. I don't have to hand, I can't quite recall the total number of people who have died, but it is a substantial number in recent years, and there's been many other crashes that, whilst have not been fatal, they could just as easily have been.
Just back on Jenny McCarthy's story, you did say it was nonsense, but every time she tweets, it's obviously paid attention to, especially regarding her comments when she left. Is there any effort at all to reach out to her to broker, I guess, some kind of friendship or working relationship?
I'm far too busy with matters that are important to be wasting my time on nonsense.
Have you checked with your staff just to make sure that it is nonsense?
I don't need to. It's nonsense. My staff are working hard for all Victorians. They haven't got the time or the interest to be involved in that sort of stuff.
Is it not a concern to you, though?
No, I'm concerned with keeping Victorians safe.
Premier, the justice legislation
It's not a concern to me at all.
So she's making it up?
Well, you can draw your conclusions. I've answered your question. Hang on. I've answered the question you've asked. Sorry?
I'm interested to hear if you think she's making it up.
Well, you heard what I said before. It is nonsense. I probably can't be any clearer than that.
Premier,
my staff work very hard for the people of Victoria. They're not involved in that sort of nonsense. And any suggestion that they are is plainly wrong.
The justice legislation amendment bill.
Yes.
Was it your intention to stop victims' families from speaking out?
No, not at all. I had a conversation a few weeks ago now with Darcy Ehrlich and her sisters, and the reason I did that was because when I met with Benjamin Netanyahu, the Prime Minister of Israel, in Israel, when I've met with the President of Israel, when I have had many telephone conversations with former ambassadors, head of foreign affairs, when I've done all the work that I've done, the small part that I've been privileged to play in getting justice for that family, I just wanted to explain to them that this had been a typo. This was not the intended outcome, and I'm very pleased that they accepted my assurances, and I'm sure they're pleased not only with what's happened since back in Israel, but they and other victims have to be at the forefront of all the work that we do. They have to be the sole, the most important voice. And I think we've got an outcome that basically respects that.
But is it not the case that now that legislation will prevent the families of murder victims from speaking out if it's going to identify those victims?
I'd need to get the Attorney General to come back to you on that.
That's what's.
Yeah, well, let me have Jill come back to you and speak to the details of that.
Probably a question as well, please.
I was going to ask you as well, when I asked Professor Sutton what your stance is on the border, if there was a second wave somewhere else in Australia.
I can only concur with the Chief Health Officer. We would look at that on a case-by-case basis, and there are many different variables, not all of which could be foreseen at this time, that would come into our thinking, and I'd get advice and we'd make decisions. I'm much more focused on getting the borders open than I think not particularly usefully speculating on what might occur in weeks and months.
Just
Martin Foley.
Martin Foley, if that's okay.
Question time in 20 minutes.
Sorry, Minister.
That's answer time, yes.
I'll
Will
practice.
You be just on the, I guess, the Ambulance Victoria
yes.
revelations from this morning, will you be initiating an inquiry into allegations of widespread sex discrimination, gender-based bullying and sexual harassment at Ambulance Victoria?
this government has a zero tolerance approach when it comes to sexual harassment and bullying and unacceptable behaviour in any workplace, particularly public sector workplaces. And I know that there are conversations as we speak with both the management and the board of Ambulance Victoria and the workforce representatives, all of whom share that view, and I expect to get a brief from those organisations in the very near future.
Will you be initiating like a formal or an independent
I'll
inquiry?
wait and see what the shared determination of that group is, realising that Ken Lay is the chair of Ambulance Victoria and has an outstanding record as a leader in gender and other lenses of diversity in workplaces, and I would more than be confident that he will step up to the plate on this issue.
How has this behaviour been able to continue for so long? How has this behaviour been able to continue for so long and at this scale?
I can't answer that question. I would like that as part of the proposition from our friends at Ambulance Victoria and their workplace employees as to what the circumstances are here. I read that report this morning and I shared the concerns of those brave people who had stepped forward to share their story. I reiterate that harassment in the workplace, gender-based violence, gender-based discrimination of any type is unacceptable, and that's why we have a zero tolerance approach to it.
When do you expect to get that report back?
I'll share. As soon as I get it, I'll make sure we let you know.
As in, like, do you expect it to be in the next few weeks?
Well, I
or
don't know.
Months? You don't know.
You'll have to allow me at least some time to speak to Ambulance Victoria.
Minister, even though you've only been in the job for a short period of time, is there any suggestion that the structure of the DHHS is not up to to responding to another pandemic, and do you think it should be restructured, essentially?
I have nothing but faith and confidence in the leadership, structures and people in our department, and I think the evidence is there, particularly in the establishment of the public health units right across the state, and it's the evidence of their capacity to respond quickly, particularly around the test, trace and isolate systems, which the Chief Health Officer has reflected on. But it's not just my faith, it's the numbers and the data that has allowed us, based on their efforts, to safely, carefully and sustainably reopen. The important issue now is to make sure that all of us, the government, the Department of Health, all of the public health teams, the primary care providers and the people of Victoria partner to keep us safe and stay open.
Sorry, Mike, just one final question on rubbish tips. Are they open, not open? Can they open soon?
We will definitively come back to you
We'll get back to you on rubbish tips.
The only other thing I was going to ask was how was the whiskey? That's all.
It was a Victorian whiskey, so of course it was terrific.
Thank you.